Senior Center.
Okay.
Okay, perfect. Should I have shows at 6 something to see if it's audible? Yeah.
I'll go back. Yes. When he uses the mic, I can hear. Yeah.
Okay, perfect.
Hello. I'm Sydney.
Sydney, Donna Miller.
Nice to meet you.
How do you do?
That's
How are you doing? Doing
Wish I lived in your district.
It's
but-
okay.
Oh, okay. All right, yeah. Oh, yeah. Oh, because I'm like, I just realized I could. Okay, because I'm like, hello. Hi, Commissioner Miller.
Carla, nice to meet you.
Hi, Sarah. How are you?
I figured you guys
Oh, someone who's wearing a suit with no tie off the left. He just turned around. Hold on. And so he would email him back and forth. He told her he was talking about he has to get some information. He had that's all we all had on the separate.
I see the battery.
Right.
He was talking about movement on state legislature and state. I think I would make it
I just grabbed him and stuff.
Wait, no.
see my battery from here.
So I find myself not any. Right, I know, right there. Yeah, I know.
His wife's hospital.
Just collapsed. So anyway, the whole department was basically retired or left or transferred. So I gotta figure out what I can recommend. I mean, this is a situation
Yeah.
well, Northwest is going to drive everyone else.
Okay.
So, but I'm open to getting the right person regardless of when they're at.
I'm not sure. I mean, ask about
Well, I'm looking for someone who do that. I'm looking for talked about it well later, but that's a thing. I certainly did.
so that would obviously be.
I'll see him in a couple of weeks. I can ask him, but and he's given me good recommendations on others. And I think go down next year. If you have someone brilliant. That's not.
You know, right. In fact, I know two.
Let's
One
hope
of them is Wendy's, and one is the one I worked with for years at Rush.
I know that's a whole special field in itself.
Just so you know.
I asked him,
Oh, cool. Maybe, there's a regular, Heisman's report. And, thank you. So,
Illinois Single Payer Coalition.
that's one. And the other.
They told me to come up here. I'm not sure why. Oh.
It's PRs. I'll just find it.
Thank you all for being here. And right here, everyone. Thank you very much. That was painless.
Morning, everyone. I think we'll go ahead and get started. My name is Dr. Amir Sharifzadeh.
Get him to speak up. Speak louder. Speak up, please.
Can you guys hear me
That's
now?
better. Good.
Okay, thank you. Again, my name is Dr. Amir Sharifzadeh. I'm a ER doctor and a board member of the Illinois chapter of Physicians for a National Health Program. We're co-organizing this forum with our friends from the Illinois Single Payer Coalition. I want to start by thanking Church St. Paul and Redeemer for having us. And thank you all for being here. Please sign in if you have it. And if you have a question for the candidates, please fill out one of the note cards and one of us will come around and pick up the note card. We'll try to get through as many questions as we can. Of course, thank you to the candidates for being here, given the respect and attention this topic, healthcare, deserves. You know, we wanted to host this forum because we believe healthcare needs to be front and center in this election. Voters deserve to know how you're going to fight for them when you go to D.C. Because we know we're all in a healthcare crisis. We've been in a healthcare crisis for a long time, and it's only getting worse. At the same time, the for-profit and insurance industry and big pharma have only been getting richer, making billions of profits while the patients suffer. The reality is, despite our best intentions as doctors and our years of training, the truth is this system was not set up for us to succeed in keeping our patients healthy. Every year, deductibles, premiums, medication copays go up, while the rates of claim denials increase as well. And my patients wonder what their insurance even covers. How much more of their money will these corporations take while they ruthlessly deny care in a country that already spends more than any other country in the world? That's why at PHP, we believe we need to stop our country's failed experiment with for-profit healthcare insurance. It was destined to fail from the beginning because when you prioritize profits over patients, only corporations, healthcare CEOs, and private equity win. You know, being a doctor in this country, it makes you face some difficult questions. How is this patient going to even afford the blood thinner that's going to control the blood clot in their lungs from killing them? How is a patient with asthma going to afford the inhaler that's going to control their asthma at home and prevent them from having an ER doctor like me put them on a breathing machine? Is the healthcare I'm providing by doing what's right for the patient actually going to put them into bankruptcy? You know, meanwhile, my patients are asking themselves, do I pay for my insulin? Do I pay rent? Do I pay for groceries for my family? Or maybe I can ration my meds a little bit, ration my insulin, and try to get by. And that leads them down a dangerous path that I've seen way too many times. You know, just the other day I had to admit a patient to the intensive care unit because their kidneys were failing and they needed emergent dialysis. Why? Because they lost their job a year ago, they lost their insurance, they couldn't pay for their insulin and other medications to protect those kidneys. Meanwhile, we have a president who is more concerned about keeping his billionaire friends happy and exploiting oil reserves in Venezuela, and instead of fixing our healthcare crisis, he's cutting Medicaid, stripping away ACA subsidies, and privatizing Medicare even more, which exposes our elderly to the same money-hungry vultures that are destroying healthcare. And let's not forget they're also confusing the hell out of patients. Facts are no longer a thing. They're defunding scientific research. Immunizations are somehow harmful now. Apparently, pregnant mothers taking Tylenol are going to give their kids autism. We know that these are all lies. We can no longer trust what used to be our country's leading public health institutions. You know, I could go on. DC has been trying to ban care for our trans neighbors. They've been eroding the relationship between women and their doctors, and succumbing to the gun lobby by doing nothing about the gun crisis, wreaking havoc in our communities, laying wounded bodies in ERs around the country. So when one of you goes to DC, we can't afford for you to passively take up a seat in Congress. We need someone who's going to lead healthcare reform, fight corporate power, and fight for this district. I'm going to pass the mic to our moderator, Joseph Carr, who is a 2nd District constituent, a parishioner of this church, a small business owner, a patient advocate, and has had the unfortunate experience of navigating our healthcare system as a survivor of necrotizing fasciitis, known as the flesh-eating bacteria disease, and surviving cancer, as well as a lifetime of battling chronic illnesses. Thank you.
Good morning, and I think that this will be the last weekend I say Happy New Year to everybody. I want to thank the sponsoring organizations and the outstanding team of volunteers for the amount of preparation that went into hosting this candidate forum for Medicare for All. To set the stage, I'm going to allow the candidates 2 minutes to introduce themselves and their healthcare platform. Our timekeeper, Dr. Cindy Doe, in the front, will be keeping the time for candidate responses to make sure that each candidate has the appropriate time to answer questions. Candidates, please be respectful of each other and the time to respond. After the introductions, each candidate will have 90 seconds or a minute and a half to answer a question. I'm not going to repeat the question once the timer starts. If I decide to ask a follow-up question, the candidate will have an additional 30 seconds to respond. In the audience, you have a question, as Amir indicated, there will be a Q&A portion with a forum that the audience can ask questions. To keep in control, Amir will come around in about an hour to collect your questions on a note card. Then I'll ask the audience questions during the last hour of the forum. So, with no further ado, I will start the questions here on my left. So who are you and why are you running for Congress?
Good morning, everyone. And first, I would like to thank you for putting on this forum so that we could hear from each of us today. But my name is Eureka Brown. I am currently a commissioner at the Metropolitan Water Reclamation District. I've lived in the 2nd Congressional District my entire life. I've never lived anywhere else because I believe in this district and the promises of this district. But what really propelled me to enter into this race is my son contracted an environmental illness that nearly took his life. So as you can imagine, I became a mother on a mission, a mother who wanted to fight for environmental justice because I believe clean air and clean water should not be based upon your zip code. I am currently a nonprofit executive at the American Academy of Hospice and Palliative Medicine, and I've also spent time at the Alzheimer's Association working with patients with serious illnesses. And what we're seeing is that there needs to be someone that's going to fight in Washington, D.C., not only for adequate care, but access to care, workforce development, because we're seeing a decline in the workforce due to burnout and not necessarily having the proper tools to do the jobs, and that's the nurses, physicians, and the interdisciplinary team. So I've spent time in healthcare. I believe in it. I believe that we should create systems so that people can have access, that they can afford health care. We've also seen firsthand how families are really struggling. They're cutting their medication in half. They do not have access to the necessary hospitals in their communities. So if elected, I will go to Washington, D.C. to fight for universal health care because I believe that that is a human right and everyone should have access to it. So I'm Eureka Brown, running for Congress in the 2nd Congressional District. Thank you.
My name is Jesse Jackson. I'm running for Congress in the 2nd Congressional District. My platform is fairly simple. I believe that every American has the fundamental right and was born with the fundamental right to health care of equal high quality. It is not in the Constitution. And by virtue of it not being in the Constitution, health care in America is inherently, structurally separate and unequal. 50 different state systems, 3,000 different county systems, 20,000 municipal systems, and the American people, particularly people in the 2nd Congressional District, find themselves trapped in that system. Our policies and what I believe in are simple. We're going to upgrade the Affordable Care Act, which was designed to evolve, to get better, not to get worse. Except Republicans in the Congress of the United States, from the moment that we passed it, and I voted for the Affordable Care Act, they decided to call it Obamacare. We never voted on Obamacare. We voted on the Affordable Care Act because 44 million people were working hard every day, and at the end of a hard day's work, they still could not work. The biggest crisis in America and in healthcare is that healthcare is in crisis. Affordability is in crisis. People cannot afford coverage. The ones that can afford coverage are getting huge increases in their premiums across this district. Access to doctors is in crisis. Some of our communities in this district are medical and pharmacy deserts. Caregivers are in crisis. Nearly $600 billion a year is not even calculated by the nation's healthcare system because we love our parents, we love our loved ones so much that we change the trajectory of our lives to take care of them at the stage of their lives. And so I'm running to expand healthcare, make it a fundamental right for all Americans, but that's simply not possible until we go to the Constitution of the United States, and I intend to do that.
I'll use the podium. Good morning, everyone. I'm Donna Miller, but who am I? I'm a Black woman in America. I am a woman woman where maternal health is not just a talking point for me, it's personal. I'm a Black woman where we have a maternal health crisis in our country. Black women are now 3 times more likely to die as a result of childbirth, and this data is 90% reversible. Anything that's 90% reversible means we can do something about it. Black women in America are seeing how the odds are stacked against us every single day and at every turn in this healthcare system. I've lived these gaps in the healthcare system when I delivered my first child. I was looked at as a drug-seeking Black woman when I went to a major hospital institution. I was asked 3 different times, are you taking drugs? Do you use drugs? Have you ever used drugs? And when the question was asked and answered, they said, we just wanted to make sure you understand the question. This is what happens to Black women every single day, and leadership in this issue means that we are listening to what women say, and especially Black women, before something is wrong, before something happens, before a tragedy is happening. And that's why I would advance federal policies in the Medicaid postpartum coverage, to see that coverage for a full year. I have worked already as a Cook County Commissioner to expand doula program that we got, the first one at Cook County, for the next 3 years, $3 million. These are the kind of policies that I've worked as a public health official. And as a public health official in one of the largest public health hospitals in the entire country, I want to see that we are managing the health of the entire public. I would take this with me to Congress. The doula program is one thing that's duplicatable, and I want to see that instituted on a national level.
Hello, I'm State Senator Robert Peters of the 13th District, and I have 2 minutes, which is going to be hard for me to do if anybody's ever talked to me. So I'll try to keep it brief. Let me just start off by saying when it comes to healthcare, it's very personal. I was born hard of hearing, I had a speech impediment. I grew up having people tell my parents they should have never adopted me. I grew up with people telling me I would never get out of 8th grade, I'd never get out of high school, I would never graduate from college. I grew up in a world in which disability was treated as something that was going to anchor me down instead of being deeply part of who I am. And so healthcare is deeply personal to me on an economic level because I know what it's like not to have health insurance or to have health coverage and before we had the ACA, having a pre-existing condition reject you, and then knowing that you're going to have to ration your antibiotics like I had to do when my tooth was hurting me and I visited the emergency room, and then following that up with a medical expense bill, or having to take your dad's cancer medication because you're in so much pain that you need to just soften it, and you're taking your dad's old cancer medication just to try to fill the pain. People are struggling when it comes to healthcare. The ACA was a good step, but we need to go further. We're the richest, most powerful country in the history of the planet. It is ridiculous that we are paying as a country this much for healthcare while so many people aren't getting adequate healthcare. The 2nd Congressional District also does not have a level 1 or level 2 trauma center, except a level 2 maybe in Kankakee, but not anywhere else in the district. And people don't have the infrastructure for their healthcare. I'm proud to be endorsed by Bernie Sanders and Pramila Jayapal, the 2 sponsors of the Medicare for All Act. I'm proud to be endorsed by NMU and INA and healthcare workers who are doing the work on the ground. I'm proud to have done the work to put hundreds of millions of dollars in safety nets to take on the insurance industry, and I firmly believe that in the richest, most powerful country in the history of the planet, we can give everybody healthcare. Thank you.
Thank you. I am State Senator Willie Preston. I was stabbed multiple times when I was a teenager by my own brother. I nearly lost my life. There was no trauma center like there is today in this neighborhood in Hyde Park, so they had to transport me to the west side at Mount Sinai, soaking in my own blood. The doctor told me once I woke up, you nearly lost your life, but whoever wrapped those t-shirts around all your stab won't save you. This informs me about how I go about my lawmaking today. We have to make sure that we have equitable, accessible health care for all, and that includes Medicare for all, which is why couple days ago when we were debating in Livingston County, I said some opponent that's not here today is disqualified because he declared that he does not support Medicare for all. That's wrong. My wife has multiple sclerosis. Imagine that. Young people, my wife is diagnosed with multiple sclerosis. She cannot walk straight anymore. She doesn't know what's going on. My son, who's sitting in this audience right now, is studying at the University of Illinois in Chicago to become a medical doctor because he was diagnosed with autism. And he didn't speak till he was 5 or 6 years old. For not for us being able to take advantage of all of the health care that we have here in this country, he would not be sitting here today successfully on his way to becoming a doctor. I'm going to fight to make sure that we bring a level 1 and level 2 trauma hospital to the south side of Chicago, to the south suburb, because we must make sure that no one is on the edge of death because they don't have access to health care. And in order for us to do that, we're going to have to send not just another politician to Washington, we're going to have to send a fighter to Washington. We want different results, but we got to send different people. I believe I'm different because of my life experience, my legislative experience, and successes. And I'm going to make sure that I look bipartisanly across the aisle because the truth of the matter is, this is a country that's split 50-50. And there are no Democrats and no Republicans differences in health care. Sorry about that.
Good morning. Thank you for having us this morning. My name is Val Regis. I'm stepping up to replace my former boss, Congressman Rodney Kelly, who, as you know, is running for Senate. A little bit about myself. I work for 2 members of Congress, including a woman named Nita Lowy, who was the first woman to be the chair of the Appropriations Committee, which is why I learned how to track federal dollar spending and ensure that communities were applying for them. And as it pertains to healthcare, I recognize that the unfortunate so-called big beautiful bill is getting ready to cut 17 million people off their health insurance, and specifically the 2nd Congressional, 40,000 people actually were estimated by 2027 will be losing their health insurance. Therefore, somebody that should probably know. And the reason why we got to pay attention to that is simply because we know a lot of our hospitals, their revenues are being generated by patients with Medicaid and Medicare. So if they're not even going to have those patients to come in to use their services, chances are those hospital services might have to cut down, lay off. In some cases, what I'm hearing in the rural side of the district is they might even have to shut down. And that means we're going to have a lot of people running around without health insurance, and chances are we're going to have to subsidize them out of pocket. And I use my mother as an example. She's a widow, and she has 5 kids. We're going to make sure she's solid by shipping out of pocket if needed to be. But not everybody has that support system. And the reality of it is, that money that we're going to be using to subsidize that family member, that could be your auntie, your uncle, your cousin, okay? Or your disabled niece or nephew that's on Medicaid. That money could have gone towards your retirement, vacations, or even probably somebody that you're trying to sponsor for their education. And this is going to be impacting our budget if we're going to be clear for some families that's going to be meaning life and death. So I'm stepping up to let people know the consequences of the so-called big beautiful bill, and how it's only beautiful for a small percentage of people, while the rest of us are getting screwed up by that process. Thank you for having me this morning.
Thank you. For the next piece, I want to have everyone who is going to support this legislation to raise their hand. So there's a series of questions here, so if you support this and are committed, please raise your hand. 1, do you support a woman's right to make her own decisions regarding her health care? Number 2, would you co-sponsor the Women's Health Protection Act that would protect the right to access abortion care and provide legal protections against medically unnecessary state-level restrictions? Number 3, would you vote in support of the Protecting Sensitive Locations Act, which restricts federal immigration enforcement actions, specifically prohibiting them within 1,000 feet of certain sensitive locations, including schools, hospitals, places of worship, H.R. 1061. Number 4, do you support Medicare for all? Number 5, would you co-sponsor H.R. 3421, the Medicare for All Act, as introduced by Congresswoman Jia Paul, which establishes a national health insurance program that is administered by the Department of Health and Human Services? Number 6, in your campaign for Congress, will you commit to Medicare for All being one of your key issues? Okay. You all saw that, right? Everybody raised their hand. So now we're going to move to the next questions, and we're going to start with Congressman Jackson. The One Big Beautiful Bill imposes more frequent Medicaid eligibility checks and work requirements. Conservative estimates suggest Illinois could lose hundreds of thousands of enrollees. If elected, what concrete steps will you take to impose or mitigate the impact of these redetermination and work requirement provisions, especially for low-income residents in Illinois too, who rely on Medicaid for basic care? Once you answer, please pass the microphone down.
This won't be the first time that I've opposed the work requirements for the people of the 2nd Congressional District. When I was elected in 1995, I came in the middle of Newt Gingrich's contract with America. In the contract with America, he required a work requirement. Republicans in Congress insisted that there be a work requirement for housing subsidies. I fought against that on the floor of the Congress of the United States, and I certainly will fight against it in the form of any attachments that seek to limit Medicare for all or health care for all as some kind of requirement from the federal government. We don't ask rich people for a work requirement for the tax breaks that they get, but we ask working class and poor people to give another 8 hours, give another 4 hours to get a basic federal benefit. We need to speak the same language. When rich people get it, it's called a tax break. When we get it, it's called some kind of work requirement. Slavery, by any other name, is the same. It's our government that should distribute it to all of us fairly.
Thank you. As a member of the Cook County Board, I already see how people who have uninsured or underinsured are able to have access to high-quality health care. I would continue to look for that on the federal level and not have a work requirement, because work does not determine your health. Your health is your wealth. And many people do not have a healthy, wealthy health system that they can take part of. What we also need to look for is making sure that hospitals who provide charity care on any level are providing that type of care to anyone, and the hospital system is broken in that sense. Charity care should not be determined by the fact that there is a place you can go, like a county system, and you're given a prescription, literally, to go to the county hospital as opposed to staying where you were originally for your health care. So I would want to make sure that we have equitable systems in place for health care, no matter where the person lives, no matter what their work requirement, work is, and everyone who has the ability to go to a system to get the high quality health care that they deserve and receive at every level, whether it's on the federal, county, or state level.
Thank you. So I'll just say this: we need to undo this bill. It is one of the largest tax giveaways to the richest people in this country. We have someone like Elon Musk who's on, out there at board meetings saying that he, plans to be a trillionaire, while at the same time, in the 2nd Congressional District, we're talking to 40 to 50% of people who are on Medicaid or relying on Obamacare subsidies. That is a ridiculous injustice. So we need to undo that bill, and we need to also not only expand funding into Medicaid, we need to expand the use of it. This is something I care deeply about as a state senator. You know, when we think about tackling gun violence and community violence intervention, we should make sure that work is maybe covered under Medicaid. And so as we work to undo this bill, as we work to expand Medicaid, we do need, I'm going to repeat it over and over again, we're at a single payer forum. We're the richest, most powerful country in the history of the planet. We are, by a large margin. Everybody should be guaranteed health care. It is ridiculous. It is a disgusting injustice. And so as we work to undo this terrible bill, and as we work to expand Medicaid coverage, as we expand what it can cover, and be creative with it, including around housing and around community violence intervention, we need to also ensure that we are guaranteeing people health care. That is what we need to get done, and that's what I plan to fight for when I get to Congress. Thank you.
By a show of hands, how many people in this room believe that we should have a system of health care that is for profit? Not a single hand was raised. I agree with my colleague, Senator Peters. We should repeal this bill. I think in order for us to do that, we have to think practically how it could actually be done. I think you're going to have some bipartisan skill sets. I grade myself as being the most bipartisan state senator in Illinois, when we don't have to be, because we have a supermajority. This country split 50-50. I intend as the next congressman to walk across the aisle as I did here in the state senate and build relationships, because Republicans have constituents that are sick and tired of this system, as well as Democrats. But the truth of the matter is, we have to reimagine this nation's healthcare system in full. We need to fight to break the current system, because it should not be a for-profit system at all. And if it were not for that, if that was not the case, we wouldn't be talking about repealing any bill. Full stop. If you're in this country, you deserve to be able to get health care. You deserve to be able to get the medications that you need. This is a human right, and if we, as a leadership in this United States Congress, do not start there, then we're not going to finish, not in our lifetimes, because we're taking around the edges. We're taking around the edges. This country has the resources to ensure that everybody can have the health care that they deserve, but yet, we're not doing that. Time's up. I'm not paying attention.
So number one, we have to discuss blocking and reversing those waivers. And one of the steps to do so is to challenge HHS to an oversight hearing, making sure that the conversation becomes more public, so that at least the public can become a bit more informed about how the bill is actually impacting even communities from low, disinvested communities, I should say. But number two, I agree with most of what's been said today, but we got to take it a step further. There's been a lot of conversation about Medicare for All, which as you've seen everybody supports, but the system is broken. We're having conversations right now about subsidies, and even if we can keep them, when the reality is, let's say we do implement, first of all, we do block these waivers, and then we do go on and pass Medicare for All, which is going to be a big fight. We're dealing with government bureaucracy here. We're expecting our government to be able to fully run an efficient healthcare system to support all of us. I think we're going to have to start looking at more innovative ways, if you will, for us to not only be able to ensure everybody is insured, but also find a fair balance, if you will, between private agencies and the government to find the most efficient way to making sure there's some level of allocation of funds, if you will, that every one of us will not have to worry about having health care. And finally, number three, I don't think we can have that conversation without considering the fact that we should start talking about the fact that healthcare should be a legal residency for all of us in the 21st century. That's my 2 cents on this.
As a healthcare professional and working with doctors, the interdisciplinary teams each and every day, I see firsthand how important Medicare for All is. Just last week, I was at Duke University, and I spent some time in Atlanta at Emory University, shadowing doctors. And when you see the faces of some of these patients who are faced with some very serious illnesses, and they're being told that they cannot receive the care that they need, That is a problem. That's a problem in this country. It's very heartbreaking to see that, because we want all of our family members to have access to care and to be treated with dignity and respect. Each and every day I deal with patients who are living their last days, and we work very hard to make sure that they're comfortable, and they shouldn't have to worry about the bill that's going to come in their mailbox. So this is something that is very near and dear to my heart. I also believe that we have to stop privatizing services such as hospice and palliative care, where the rich keeps getting richer and the poor is getting poorer. And they put you on services and things that you don't even need. So when you have the health care, you're fortunate enough to have it, then you're getting beds in your houses, you're getting wheelchairs, things that you don't even need, when that can go to someone who truly needs those services. So I see this every day of my life, in addition to the burnout. We have to fix this system. It is broken, and we need Medicare for all.
All right, we are going to take the next question. According to Illinois health officials and independent analysis, the Big Beautiful Bill, BBB, could cap state-directed payments, supplemental payments to hospitals at Medicare rates, significantly reducing funding for Illinois Medicaid hospitals. How will you defend or restore federal payments to Illinois hospitals and community health centers that serve large numbers of Medicaid enrollees in our district, given that funding cuts could jeopardize their operations? We're going to start with Commissioner Miller.
These federally qualified health centers and public health systems that are throughout the entire country are also here right in the 2nd Congressional District, where we have healthcare deserts throughout, from 43rd Street all the way down to Danville, healthcare deserts. We need to make sure that the funding is not only restored, but expanded. We need more focus on primary care in our communities. We need more focus on making sure that we do have birthing centers in our communities. 4934 South Bend Sims. I give you that address because it's right around the corner, but it's also where my great-grandmother and great-grandfather lived. My great-grandfather died 100 years ago because he had a botched tonsillectomy. In this community still does not have health care that we deserve, that we need, right in our own backyard, that can provide services to people in our communities. And we need to make sure hospitals are uplifting and coming, and the centers here are focused on what we can do for the residents of our communities.
Yeah, this issue's, every issue I say is like personal to me, so I'll just say this is pretty personal to me. When I opened, I talked about my healthcare challenges. Well, the first place I went to was Cook County Hospital. I went to a clinic, and I waited 6 hours to be able to see a doctor. And then following that, I went to Howard Brown in FQHC. It's where I ended up finding my primary care physician. It's also where I was able to get some level of subsidy when it came to my prescription drug needs. Having that FQHC, and I traveled great distances, finally seeing Howard Brown open on the south side was huge for me. These are important anchors for healthcare in the community. It's one of the few places people, particularly working class people, can go to get healthcare. And so what the Trump administration and what Republicans are doing is that they love to talk about how much they care about working in middle class families while making life increasingly difficult so that they can benefit their rich friends. And one way they're doing that is in the ways that they attack healthcare. So as a state, we've been doing a lot to try to protect our healthcare infrastructure. You know, we put hundreds of millions of dollars into our safety net hospitals just to try to keep them open, to keep that infrastructure there, but it's constantly an uphill battle. It's the reason why we need to have strong leaders in Congress who are pushing when it comes to healthcare equity, because states can only do so much to deal with the healthcare crisis. And so this is a very important issue and a very important fight. And I think more people should go and visit safety net hospitals, more people should visit FQHCs and I'm done talking. Thank you.
You know, I'm very proud to say, under my leadership as the chairman of the Senate Black Caucus in the last state budget, we appropriated more money to our safety net hospitals than any other time in Illinois history. I led that charge because I knew the DOGE cuts coming from Washington would be catastrophic for safety net hospitals. Hospitals like Mount Sinai, who were the source of me still being alive today. They saved my life when I was stabbed as a teenager. Commissioner Miller, you just stated something I think it's important for you to be educated perhaps. This community in particular has an incredible hospital, the University of Chicago, and they enjoy healthcare and access and equity to it. The reason why I'm running for Congress is because the South suburbs don't. Because so many places in this district do not. And we need to replicate a version of what the University of Chicago, what this community has already. And that's why I'm running. And we gotta make sure that nobody is on the edge of their life of dying because they don't have access like the people in this community enjoy today. Thank you.
So, when I worked for Congressman Kelly, part of my job was a grant specialist in ensuring that funding from HHS was coming in and that community health centers would actually apply for them. Part of my concern, we can talk about legislation, and I would advocate for to support hospitals and so on. What I'll say is that, being that we're seeing right now that there is a beef between the governor and the president, Donald Duck, we should be expecting less funding to be coming into the state, unfortunately, because out of spite. And so, as the next member of Congress, one of the ways that I want to be prepared to help health providers, or rather I should say, the health industry to be able to navigate in the next 2 years, is to incentivize collaboration between community health centers. We're talking about an organization like Aunt Martha's Community Health Cost Center that's able to provide health support, if you will, to especially disinvested communities who can't afford to come all the way out here at the University of Chicago and be able to benefit from the services that it's able to provide. But the reason why I said incentivizing collaboration is because we are expecting less money to be coming in. And what I've observed over time is that these organizations, when they will be applying for the funds, they will apply for them in silos instead of learning, for instance, from the west suburbs, where they normally submit applications collectively, ask for a huge amount of money come in, and decide how to divide amongst themselves the funding when it comes in by aggregating their numbers. So essentially, I want to step in and start encouraging these organizations to be able to apply for federal funding from HHS collectively to increase their chances of being able to at least stay afloat for the next 2 years while we figure long-term solutions to the crisis we're facing. Thank you.
So it's simple. I've lived in this district my entire life. And in this district, we need more. And I'm going to say that again, we need more. We need equity across this district. There's no reason from one end to the next that patients aren't experiencing the same level of quality care. When I think about my own child, when he was sick, when we went to the hospital in the south suburbs, he could not receive the treatment that he needed. So we had to take the track all the way to Lurie's Hospital, downtown Chicago. For so many families, that's not easy because it's very difficult to be in traffic, to pay for gas, to pay for hotels. And so we need quality care right in our communities so that people can live, thrive, and survive. So I plan to eradicate the big ugly bill and to provide more resources in our communities so that people can receive the services that they need for whatever the illness may be.
The question was, how will you restore federal payments to Illinois hospitals and community health centers? I would include a hold harmless clause in the appropriations bill for the Department of Health and Human Services. A hold harmless clause for states and federal legislation is a statutory provision that does not allow a state to lose its appropriation if, in fact, that number goes beneath the previous expectation of the state in federal legislation. It's called a hold harmless provision. Now, I don't want to tell everybody that because I will be fighting to save funding for Illinois hospitals and centers. I wouldn't want every member of Congress taking advantage of the hold harmless clause, but that's what I would do. In addition to that, we have a shortage in this Voting Rights Act district of African American nurses and doctors, medical professionals in this overwhelmingly African American district, because doctors, based upon research, tend to locate to communities that they are from. I offered legislation that created, and I challenge everybody in this audience to Google it. I offered legislation that created this report. Unequal treatment, confronting racial and ethnic disparities in health. You're going to need this no matter who the next congressman is, because this is the basis for arguing good science and why our district deserves more than most.
Thank you, candidates. Next question. Medicare Advantage enrollment continues to grow, and concerns have been raised about overbilling, care denials, fraud allegations, and the gradual shift of Medicare towards privatized models. What specific actions would you take in Congress to ensure Medicare remains robust, transparent, and not driven by private insurer incentives at the expense of patient care? We're going to start with Senator Peters this time.
Yes, so I think in Congress it's thinking about it from both a consumer protection side as well as healthcare regulatory side. And so as a member of Congress, it's about beefing up the oversight that needs to happen when it comes to Medicare and Medicare Advantage. And it's also important to know that when it comes to privatization of Medicare, it has been used in the form of a creep into privatization, not just a giant blast through. So, oftentimes people privatize, they privatize this giant, big privatization move where with Medicare, they tried to do that under Bush, for example, and then they came back and now it's been a creep. And so it's going to be important for Congress to play some level of oversight, both in the consumer protection side as well as healthcare regulations. I would also say that when we win back the White House, we need to actually push to make sure that we have an administration that is going to be aggressive against people who are just trying to gouge people for profit to make sure that they can boost whatever stock margins or things that they need. So I think it's twofold. It's using Congress, well, in possibly having a minority in the Senate. My hope is that we win a majority in the House, while at the same time setting us up to have an administration that both from a consumer protection angle as well as an health and human services angle is creating a regulatory framework that is overlooking when it comes to Medicare Advantage.
Thank you for the question. I want to start by saying I do not condone violence in any form or fashion. But I want us to think about something we just recently experienced and observed in this country. A guy by the name of Luigi went to New York, stalked a private insurer executive, murdered him, got arrested, and has a fan base all across the nation growing and cheering him on. Why would we be cheering on a murderer? It's because Americans are empathetic to somebody and not empathetic to that executive, because we know private insurers have robbed us of health care, denied claims, and people are sick about it. In Congress, I'm going to work to make sure that we cap profits, to make sure that these private insurers are disincentivized from making these denials and growing their profits while Americans are dying. And in order for us to be able to do that, again, we're going to have to work bipartisanly across the aisle. And I intend, the moment I get there, to start building relationships both on the right and the left side, because there is no right and left in this country. It's just Americans.
Number one, I would advocate to protect senior choice. Because as you know, as a senior, you get locked into your health insurance, and if you try to pivot, there's penalties with that. So let's talk about that. Number two, as you know, it's paying more into Medicare Advantage, except versus the traditional plan, if you will. Because the conversation is being driven heavily, mostly by private insurance. Okay? Doctors, sorry for the doctors in the room, But by doctors, by folks, for-profit people who are actually driving this conversation versus the American taxpayers who is put into the system, those of us who've been paying into it, or was expected essentially after a while to be able to cash out of it. So, in order, again, for us to have a larger conversation, you're going to hear a lot of solution and policies here today. But until we come back into number one, discussing accountability in terms of how we ensure that the private industry, okay, is not only being regulated effectively, and that even if we start to switch and pivot now towards the government and implement to some degree our health system, unless we have a conversation about the fact that that conversation is being driven by folks who are trying to make profit off of us, we can talk about this all day long, and we're not going to get anywhere. So I'm saying, as a starting point, let's start holding them accountable and start looking at ways to have government be a little bit more efficient in how we're implementing whatever the next healthcare plan is going to be, if it's Medicare for all, which again I'm in support of. Thank you.
In Washington, D.C., we need fighters that will fight to protect profits over people. I also believe that we need to end incentives to reward denials. That has been a huge problem in healthcare. In addition to that, I will work hard to protect and reinvest into Medicare, traditional Medicare. And we also need to oppose backdoor privatization in the healthcare system as well. So those are some of my top priorities that I will fight for in Washington, D.C.
The question was, what specific actions would I take in Congress to ensure Medicare remains robust, transparent, and not driven by private insurer incentives? I would strengthen Medicare by expanding benefits like dental, vision, hearing, long-term care, and even caregiver provisions. You make the system more robust by uncovering more people and the needs that they have in the system, making it very difficult for Democrats or Republicans to shrink Medicare coverage because more people have needs in the Medicare system that are presently not covered by Medicare. So we add to it dental, vision, hearing, and long-term care. That's what Barack Obama and what we meant when we passed the Affordable Care Act. It's supposed to be evolving. Accepting it the way it is, it's reducing. It's supposed to be expanding.
I agree that the healthcare system needs to be overhauled and we need to look at expansion in various areas. The wife of a dentist agrees with expanding dental care as well. But I also think that we do see huge problems with the prior authorization process. I examined that process very in depth here at Cook County Hospital, and let me just tell you how that meeting went. 30 people came to the meeting to explain to me how the prior authorization process works. I said, since there's 30 people here, I already know there's a problem. I don't want to hear from 30 people. We know that there should be one small solution to fixing prior authorization because it doesn't benefit patients. And I would work in Congress to make sure that the prior authorization process is overhauled across the entire country. Patients need doctors to decide what the best medication is for patients, not a healthcare system or a healthcare insurer to decide that for them. And when we're looking at the prior authorization process and how it's not incentivizing us to have good outcomes, that is why we have a problem in our healthcare system that needs to be fixed, and Congress can help do that. I also agree with expansion of hearing and vision and dental care. Primary care is where we need to go back to the basics on as far as getting healthcare coverage for our citizens.
Next question. We are living in an era of vast misinformation. We have seen the head of H HHS repeatedly propagate false scientific information that threatens the lives of all Americans. What role do you see for Congress in combating misinformation and holding our cabinet leaders to account? Senator President.
I come from a community, the African American community, that in this nation has a troubled and storied past and history of having no access or little access to the healthcare system in this country. People being experimented upon unfairly. My people, we can go to the Tuskegee experiment and on and on and on. I want to acknowledge something. Misinformation is being accepted because we have a troubled past. The best way to guard against misinformation, and we're going to have to contend and battle with this, is to provide access, equitable health care to people. You cannot trick anybody who is getting served properly. And so, as a congressman, I'm fighting. We're going to make sure that we have a level 1, level 2 trauma hospital, birthing center, so our women are not having babies on the side of the expressway, like we saw from a Dalton resident of the 2nd Congressional District just a few months ago, after she was denied care in an Indiana hospital. She should have never had to go there. And so let's be very clear. We're going to have to confront even government leaders in a very, very serious way when they mislead folks. But we got to make sure that we actually deliver real quality health care, and that's the best antidote to misinformation, serving people actually in this country, giving them the health care that they need and that they deserve.
We are at a time where you go on social media, you might have a reel that might take you down a rabbit hole of disinformation. Everybody's living in a little bubble of reality, if you will. And this is one of the reasons why, to some extent, even the Democratic Party has been having a tough time navigating this era, so to speak, because on the side, on the right, the MAGAs, they are just spewing a lot of disinformation where people are getting confused to the point, you remember back in 2020 when people assumed that COVID, you can actually get COVID-19 through 5G. Like there are people who actually believe that to the point they were not even going out there and getting their shots. I believe one of the ways to combat disinformation and misinformation, because disinformation is more intentional, is number one by creating a task force, a community task force, and making sure that there's active engagement between the congressional office and the communities to keep the information flowing from Congress and right back to the community, letting them know, hey, this is what's actually happening. But in terms of accountability, let's be clear. We're gonna have a tough time holding any cabinet member accountable if we don't flip the House by the end of the year. Which that means we're gonna have even larger challenges in our hands on disinformation because they don't look like they're trying to leave right now. Considering that they just broke an entire ballroom and they built a whole ballroom of gold in the White House, they seem to signal they're not trying to leave. So number one, we gotta flip the House to be able to hold them accountable and to be able to slow them down. And number two, we gotta ensure, from my position, as what I've seen that's worked before, create a task force, a local task force to keep the community informed of what's happening. Thank you.
As a First Amendment advocate, I've spent time to work and defend the First Amendment of the Constitution. And what I believe is that we need to build trust back in our communities. There is a lot of information that is going out there, but I believe we need to work really hard to protect our democracy and to educate the communities on information that they can trust. I'm also vulnerable to the fact that we need, we've been silenced for so long. So I think we need to tread carefully with censorship because that has silenced so many communities that have a hard time speaking for themselves in the first place. So I believe we need to build back trust in our communities, education in our communities, and they need leaders that they can trust that is going to go and do the things that they say that we're going to do. And I think that that's on both ends of the spectrum, that we have lost so much trust within our communities. Each and every day there's a new headline, and it just takes people right down a rabbit hole. And where can people go find the information that they need? Who can they reach out to that they trust, that they believe that they'll give them the right information to make sound decisions for their families?
As a member of Congress, what role will I play in combating misinformation and holding cabinet leaders accountable? I would combat misinformation and hold leaders accountable by advocating for media literacy, pushing for social media platform oversight, demand hearings on disinformation, and using social media companies' own platforms to tell the truth. I would also hold oversight hearings and demand answers from the executive branch by swearing them in to prevent them from lying to Congress, which is a crime. We need a Department of Justice that is prepared to prosecute members of the cabinet who lie to Congress, which means we have to clean out everything Donald Trump and Pam Bondi have done at the Department of Justice just to get the truth out of someone. That's what I would do to combat misinformation. I don't know of another way to do it except for a subpoena and a grand jury.
First, I would look at the misinformation in the healthcare arena, which is what we hear every single day. I am a certified evidence-based medicine instructor from my last previous role, and I've taught evidence-based medicine for decades. I would make sure that when we're looking at how we're talking and what information is being spread, we are using an evidence-based medicine profile to examine the information that comes out. I would lead those types of conversations internally in Congress with colleagues, providing legislation, but also externally in the field, out in the community, having town hall meetings, talking to constituents about what it looks like on the ground. I did this during COVID, when we had the first case of COVID on the south side of Chicago, and then people in the south suburbs thought it was an isolated thing, couldn't travel. We didn't know. So we started having town halls so we could get the information to our constituents. I've also been a leader in social media safety. I have national legislation right now for Congress to take on social media safety on every level, starting with our youth. And I think that that's how we would combat these issues, so that we get real information, backed by data, backed by experts into our communities and in our legislature.
So I'm just going to go here to what this is about. This is about RFK Jr. really, and the fact that he has a massive anti-vax agenda because he was an anti-vax lobbyist before he moved to HHS. Let me just say, it was 3 months ago, I decided to get vaccinated for COVID and influenza, and I said I'm going to post it online. And I put it on Facebook, and within an hour, there were like 200 people. I don't know, maybe like I had some chip putting me on or something random crazy stuff that was being said, and it got to about 2,000 comments. Some of them were real, some of them were bots. But I felt like a responsibility to share that I got my vaccine, because we need people to be healthy, and we need to combat this misinformation. And the only way to do that is by being clear online and in public. And in fact, today, I'm going to go to Walgreens at 5 o'clock, and I'm going to get my Tdap vaccine, because I'm expecting my first kid on March 28th, and I would like them not to get whooping cough. So I think it is important for us to not just lead simply with a talking point, but to go and put ourselves out there to make sure that we're communicating and fighting back against the words and the actions of folks like RFK Jr. And I'll just say, I remember it was a week before the governor announced like we needed to stay at home because of COVID-19, and I was meeting with a constituent, I'm going to be real quick, meeting with a constituent who literally came to me and was spewing anti-vax stuff. It was disgusting, and it is shocking that we are in this position now with such a terrible, incompetent person in the administration.
This will be the last question before I take questions from the audience. United Healthcare Group is now the #5 company on the Fortune 500 list, topped only by Walmart, Amazon, Exxon, and Apple. It is America's largest employer of physicians It manages over 22% of prescriptions filled in the United States, and within its corporate umbrella owns urgent care centers, home health agencies, surgical centers, hospices, and much more. How can Congress provide oversight to a corporate giant that influences the health care of most Americans?
Number one, the most practical ways to do so is to force an oversight committee hearing. If you want to make sure you want to get a conversation in public, as you know, one of the privileges that a member of Congress has is to hold a hearing, bringing in the company that they start to ask all these questions to, and making sure that you're being scrutinized both by the media and also by the public once that those interactions are released. So my proposition number one is to force committee hearings to make sure that they come out in broad daylight and they start providing the data to show how essentially they've been managing or mismanaging, if you will, the services that they say they've been providing. So that's number one. But number two, I also believe it's very important to amplify the voices of the people that's been screwed up by the system. To amplify the folks who, for instance, Rebecca in Kankakee, who's telling me how she had to sell her house to be able to afford her son's Medicaid because she's broke. Amplifying the voices of the average American that's right now being screwed by the healthcare system who cannot provide, and making sure that while we're forcing these corporations to have to go in public and share their data and discuss how they're mismanaging, if you will, their services, but also pairing that up by amplifying the voices of the people that are being impacted by those mismanagement, if you will. So I believe these are the best way for us to not only hold them accountable and to have some level of oversight for those corporations, but also amplify the voices of the people that are getting screwed in the process at the same time. Thank you.
I've been on a listening tour throughout the 2nd Congressional District, and we've heard time and time again who's going to take on the healthcare companies. I believe that we need to strengthen audits and penalties and hold the healthcare companies accountable. In addition to that, we need to end incentives for denials of care. I know I mentioned that earlier before, but in order to accomplish anything, I think we have to pull our communities together. It's going to take partnerships, collaborations, and certainly not fear to take on the healthcare companies that are taking advantage of the constituents in our communities.
Congress can provide oversight to healthcare corporate giants through aggressive committee investigations, House Oversight, Labor, Health and Human Services, Appropriations Committee, the Ways and Means Committee, strengthening regulatory bodies like the FTC and the Department of Justice, promoting transparency laws, enhancing antitrust enforcement, funding public options, and leveraging congressional power over Medicare, Medicaid funding in order to set the standard. Not one person in this room can call that meeting with a corporate giant. You need Congress. And I'm not opposed to the free market. But people's health and well-being shouldn't be for auction. In the ACA, we require insurers to spend at least 80% of each premium dollar on actual care. Traditional Medicare spends more, about 97%. Insurers are still going to have to make more money than they had before through the enactment of the ACA because more people are being brought into the system through the ACA. Since the ACA is by definition providing them with more customers. That's how they make their money. They shouldn't be making it on the backs of the prescriptions and the other ways in which they use the system to take advantage of people who are already receiving the subsidy from the government.
The problem with some of these large corporations like the one mentioned, United Healthcare, is that they are not in the business of providing health care for patients. They look at patients as consumers of health care as opposed to people who need the healthcare system to get well, to take care of their families, and to provide care within a community. I do believe in transparency on all levels. I think that if we were taking them to task from a congressional level and having a hearing, bringing each person in, but also having them explain how they feel that they've done good in the hood, how have they done good in the communities, what have they provided. Just to say that you have the largest number of physicians, you provide the most prescriptions, that you have healthcare clinics and urgent care centers, that does not mean we're providing the best care for patients. You are looking at it from a view of consumers of healthcare. Consumers of healthcare, that's a corporate term based off of making money. We need to get our wording back to where we're looking at what's best in the best interest of patient care so we can get better outcomes, so we can eliminate healthcare deserts, so we can improve cardiovascular care, so we can not have women dying from childbirth, so we can not have children committing suicide because we don't have enough behavioral health clinics in our areas. Thank you.
I mean, I like taking on the insurance industry. I work with Governor Pritzker on passing the Illinois Healthcare Protection Act, which bans step therapy, so fail-first treatments, where the insurance industry will usurp the doctor to insert what they think is the best treatment for you, to make sure that your doctor's recommended treatment is the one that you're able to go on. 2, it ran prior authorization for anybody experiencing a mental health crisis for the first 72 hours in a hospital, both knowing this pain because of my own mom's mental health issues and a close friend. That is huge. The first 72 hours is what stabilizes a person so that then they can be able to go home and live their life. 3, it expanded the Department of Insurance's ability to do rate review, to basically regulate insurance rates in this state. And 4, it made sure that insurers had to keep their networks clean, so that you knew what doctor was in network, so you weren't shocked when you found out your doctor was in network. We need to have that same energy and drive in Congress in taking on the insurance industry. And I would say, first of all, also we need to think about this. They're making one-way profits. They're insanely rich. We need to tax and cap CEO profits. We need to make sure we're going at the insurance industry that treats, as the Commissioner says, patients as consumers. And of course, what I would say is we wouldn't have to worry about United Health in terms of an insurer when we have Medicare for all.
With all due respect, everything you just heard will not result in anything changing. Break them up. They're too big. We need to use the antitrust laws on the book or write them or expand them to break them up. The heart of this issue is clear. It's corruption. And with all due respect, the other night, Mr. Jackson, we were on Livingston County stage where you brought up your work with Governor Blagojevich and George Ryan. And then you sat here and you just stated a subpoena and indictments to the HFS heads. It's the only way you know to do it. Given your past, I, quite frankly, respectfully, both believe in redemption, but understand that you're the last person on this stage that could actually have the credibility to stand up to these people who are misinforming American citizens. The fact of the matter is, we're gonna have to do something dramatically different if we're actually gonna change things. And the only solution that we have and tool is to use the antitrust law to expand them, break them up. They're too big. They have the lives of every person in this room and in this country in their hands. And by proxy, their shareholders. In America, the richest, most prosperous nation in the world, a healthcare system cannot be for profit. Because if it is, each one of your lives is simply a number. And I don't believe that's the way this country should be designed. Thank you. Sorry.
I was asked how I was going to handle this if it came up. So I am going to allow Congressman Jackson 30 seconds to respond. Okay.
No, he started.
All right, we are going to start the audience questions portion. And I gotta say that thus far, please honor the time limitations. Be honorable. So, all right, we're going to start directly to my right with Commissioner Brown. In a few months, one of you will accept responsibility for representing hundreds of thousands of people in the United States Congress. How will you persuade your Democratic colleagues that Medicare for All is affordable? Keep in mind there are 112 caucus members who already believe this.
Thank you. I believe it's an easy sell. One thing for sure, the data does not lie. We are seeing people die each and every day. We're seeing people that do not have health care. We're seeing people rationing their drugs just to survive. We're seeing people who can't go to hospitals in their communities. So these are the things that I will bring to my colleagues, and in which many of them already know. But there's data that shows that we need to do something to fix our system. In one of the most wealthiest countries in the world, we are continuing to see a disproportionately impacted communities within our communities that just need help. And so I will tell my constituents that, I will share that with my colleagues, and I believe that we can move the needle, but we have to have honest conversations. We need to talk about equity. We need to talk about the communities that are being impacted the most. And even within the 2nd Congressional District, from one end of the next, service and care and dignity and respect is not the same. So those are the things that I will share with my constituents if elected to Congress on March 17th.
From my perspective, we need an articulatable goal. People of the 2nd Congressional District and the people of the country can understand. It takes 218 people to get anything done in the Congress, and then to send it to the Senate and to get the signature of the President of the United States. That's why the goal ought to be that every citizen shall enjoy the right to health care of equal high quality. It ought to be in the Constitution. It's not. If we have a constitutional right to own a gun, we got a constitutional right theoretically to get shot, then we should also have a constitutional right to check into the hospital of our choice to get better after we do get shot. If the right wing argues they have a right to a gun, we ought to be able to argue that we have a right to health care, that we have a right to a clean, safe, and sustainable environment, that we have a right to education, that the rights that are not presently articulated in the Constitution ought to be the big goal. Under the big goal is what can Congress do? We can transform and evolve the ACA to cover all of the American people. With its market mechanisms, we can move in the direction of a single-payer system. But why not build hospitals like we're building battleships and preparing for war? This is the 97th birthday of Martin Luther King Jr. He called on a revolution of values beyond Vietnam. And we need a revolution of values beyond Venezuela. And I'm hoping that the next member of Congress from the 2nd Congressional District can make that case to the nation and to the people.
How do we build conversations? We have conversations, first of all. 62% of Americans already believe that we should have health care that ensures all Americans. Gen Z, who's in Gen Z in this room? Most of us are not. Raise your hand, yes. This is for you. I'm not saying we're not gonna be here, but we need to build a healthcare system that is for people who are gonna be able to take advantage of the healthcare system. Like I tell my kids who are 22 and 20, everything I say about maternal health and for anything related to behavior health, tell your friends, because I'm not talking to my friends, I'm talking to you. We need to talk to the next generation, they're for this. So how would we make sure that Congress has these type of conversations? We need the Gen Z people in the room. But Gen Z, don't forget, you have to learn from somewhere. History does repeat itself. So we have some history that we can share with you, even though we're not in your generation, so that you can build for the future. The future includes making sure that everyone has right to health care. We need to build education because most of our country is now going in a bad and opposite direction from public health being the standard of how we get information out there. Those of us in not Gen Z, remember we used to have public service announcements, don't smoke, give a hoot, don't pollute, all those kind of messages. We don't have that anymore. So we need to get back to educating our public about what public health looks like.
I'll just say, I love passing tough legislation. I've passed over 100 pieces of legislation. I come from a world of organizing. I remember I'm the lead sponsor of the bill that ended cash bail in Illinois, and I remember when we started that work, it was in church basement, and we would go meet with people, and they would laugh at us and say, that's impossible. And within 7 years, it went from impossible to having the governor back it, the speaker back it, the Senate president back it, having a state's attorney, both state's attorneys we've had back it and support it. I also love taking on the insurance industry. I remember when the governor's office came to me to carry that bill, they said this is going to be a tough bill. Ann Gillespie, the director of insurance, said this is going to be a tough bill. It's going to be hard to get through. And I said, I want to take that challenge on. I want to organize it and build it and get it done. And we're able to pass the Illinois Healthcare Protection Act. I remember when we talk about violence, we're in the midst of a rise in violent crime. And everybody was going to policies of the last 30 to 40 years that hadn't worked. And I worked with Justin Slaughter and LG Sims in the governor's office to help put $250 million in violence prevention just a few years ago and continue to fund and support that work. We need people who have a track record of actually getting these things done, who don't look at something being impossible as a wall, but a wall to break through. And I fundamentally believe that that is something that I can do in Congress. Now it's larger, it's bigger, there's more people, but I like that challenge. That's why I want to go to Congress, because we need people who have a vision and have the ability to get it done. Thank you.
Thank you. I can tell you I've passed dozens of bills in my short time as a state lawmaker, because I have. I can tell you that I've passed tough legislation like the Illinois Food Safety Act that rids us from these dangerous food additives that's causing us cancer and making sure that I apologize. These bills are great, but here's the simple truth that I've learned. Nothing is going to happen unless you build relationships with your colleagues. I have a skill set and a track record. When I passed the Illinois Food Safety Act, it was very difficult to pass this legislation. The Republicans were against it, and the big manufacturers, food manufacturers, were threatening to spend $1 million against me if I advanced the bill. I advanced it anyway. We passed it twice on a bipartisan basis. Republicans not only voted for the bill in significant numbers, they stood up and they spoke out against the bill because they said that, you know what, even in my district, the sharply Republican, even though they're saying it's anti-business and it threatens my career politically, he, from day one, stepped on the other side of the aisle and started talking to us, and he's made sure that this bill is amenable to business, but it does what it says it does, that's protect the health care of every single Illinoisan. I can tell you right now, we do a whole lot of talking, but this is a relationship business at the end of the day. You want to see Medicare for all get done, you better send somebody different down there to get it done, because the talk is not enough.
In 2018, we saw a huge blue wave, especially in red states, because there was a backlash against folks who were trying to repeal ACA. For years they kept saying it's going to kill your grandmother, repeal, 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 and then Trump got elected in 2016. 2017, was it Eric Ryan at the time, I believe, came up and said, okay, it's time to repeal. But we saw red states, folks, they voted out Republicans because they tried to protect their health care. I say this to say that it's very possible to start bringing folks on the other side of the aisle to the conversation with Medicare for all, especially since the polls also suggesting that they're ready for it. But let's be real. Now, on one side, we have the Republicans that are capitulating to the president. On the other side, we got some Democrats who've been bought by corporate interests, who have been very resistant to having that conversation. I believe the first step is to come from a perspective of bridge building. Being ready to have an honest dialogue by again amplifying the stories of the people that are being impacted, Republicans and Democrats. And we've seen some of our Democratic colleagues actually be tackled by going to red states, when they're not hosting town halls and having a conversation with them to drive the conversation. It's time for us to be innovative, not only by having that conversation with colleagues across the aisle, yes, about bridge building, but also going to their territories as well, as we've seen some of the Democratic Congress members have done, to have a conversation with constituents that are being impacted, but also that unfortunately are having to deal with the deluge of misinformation and disinformation. So this is how we want to start having the conversation on Medicare for All, is to essentially go into those territories, but also having conversations with Republicans who are willing to find that common ground, including those who, by the way, voted for the subsidies to remain, because they show they at least have some level of sensibility in these times. Thank you.
Just taking over for a little bit, for a little bathroom break. For the next audience question, do you accept corporate PAC money? If you do you think it will affect your ability to advocate for real healthcare reform?
The question is about corporate PAC money? Yeah, I'm not aware if I received any corporate PAC money one way or the other. Campaign fundraising is not my strength. It's never really been my strength. And so we reach out to as many small donors as we possibly can. But what I can share with you about the 2nd Congressional District is that it is a poor district. It is extremely difficult to raise money in the 2nd District. And ultimately, when you do become, or someone becomes the congressman of this district, they're going to have to be true to the district itself, even while raising money throughout the entire country just to run in the district. That's a reality in the 2nd Congressional District. Because independent expenditures and outside money seeks to influence the perspectives of people who are running for office and congressmen in 4 districts. And the extent to which you are true to the district, it shouldn't, quite frankly, matter where the money comes from if it complies with the law. It doesn't matter. But treat the South Side with the kind of respect that it deserves. The South Side is not performing like the North Side of Chicago. It's not just about the national economy, it's about the economy on 147th Street, on Volmer Road, on Lincoln Highway. It's about Michigan Avenue South, not Michigan Avenue North. It's about State Street South, not State Street North. It's about I-57 and the Bishop Ford Freeway South, not all of the interstates that are going to downtown Chicago. It's about us. Where the money comes from my perspective, is irrelevant as long as you're true to the district.
I look at this question the same way I looked at the industry. That I did come from the pharmaceutical industry, where pharmaceutical industry was looked at as influencing doctors by giving them money or giving them incentives. But I don't think any doctor in this room went to medical school to listen to someone from a pharmaceutical industry tell them how to practice medicine. So I have had a corporate check come from a like industry based off of issues related to healthcare. So I think it's only one check at this point, but that's not the basis of my fundraising. And that also wouldn't be the basis of how I make decisions based off the district. I do believe that industry does give certain information, not only to corporations, to government, but also to people. If it wasn't for industry, we wouldn't have public service announcements that are out in the public. They do have a nonprofit arm to many corporations where they're supposed to provide public service information. So I look at this in the same way, and for all the doctors in the room, I know that you're independently minded. You're able to make your own decisions based off of education and research that you come from. You didn't listen to internal pressures from corporations the same way that I would not listen to internal pressure from any kind of corporation unless it's to educate and uplift.
I don't accept corporate PAC money. In fact, we have about 30,000 donors at an average contribution of under $20. And unlike one of my opponents, I'm not going to spend $750,000 of people's money to live a lavish lifestyle. I think it's ridiculous to come on the stage and to talk about this issue like this and not acknowledge the fact that someone spent $40,000 on a Rolex. Someone spent thousands of dollars on an LCAT. Someone here spent literally money to go to a Disney resort or buy a refrigerator. Every penny that you give to this grassroots campaign is going to organize people. We've organized and had 100 people outdoor knocking just last Saturday. We have another canvas today, hit 3,000 doors. We had 58 people text banking, and we were able to get to 64,000 voters. This campaign is rooted in grassroots organizing, grassroots power, and it's fundamentally rooted in creating a country that works for everybody. And when you do that, you have to be rooted and committed to the people who are going through life and struggling each and every day. That is my focus, that is what I'm doing, and I'm not going to just sit here and tell you that money doesn't matter where it comes from or what happens with it, I don't care about it. We all care about our money, organizing. There's 720,000 people. There is a question about where you get your money, and there is a question about how you use that money. Thank you.
The answer to the question is no. But I want to just be very, very transparent. Radical transparency is what this district and what this country needs. Mr. Jackson is a very intelligent man. When I was a kid, I remember you as a congressman, I admired you. And I believe in redemption. But you know where your money comes from. And what you just represented and displayed is a politics of the past, where you named a bunch of streets after you said you don't know where your money comes from. Next to him, Donna Miller. She just displayed what every American hates about politicians. She's lying. Donna Miller is supported by AIPAC and every one of their corporate affiliates. You'll see a commercial everywhere paid for about people that are bombing other people to death. Robert Peters, my colleague, he's organizing with everybody from outside of the district. He has no South Suburban support. There's a reason for that. You're going to have to really reckon with the fact that we have to build from this poor district. Because it's true. It's hard, like you said, Mr. Jackson, to fundraise in this district. But we're going to have to do more than just fundraise to win this race. We're going to have to build power with the people in this district. That's what I'm doing. I'm proud to be supported by our Cook County Clerk, Monica Ward. I'm proud to be supported by Mayor Dalton Jason House. I'm proud to be endorsed by the Chicago Heights Mayor, Mayor Gonzalez. I'm proud to be announcing that I'll be endorsed by Alderman Anthony Beal, the 9th Ward, Monday. We're going to keep building power, but this corporate PAC decision and these demonstrations of dishonesty cannot be not called out.
Mr. Regis, Senator Peters for like 30 seconds to respond.
One of us voted for Donald Trump, and that's to my right. So that's all you need to know about that. Mr. Regis.
Appreciate it.
Now you have to forget the question. The short answer is no. But before I even proceed, I just want to remind us that the reason why we're where we're in today is because of the bicycle climate politically right now, with the mudsliding and, if you will, character decline. Look, we all have our shortcomings, and we're all stepping up right now to represent the folks of the 2nd Congressional District. Let's at least present our best foot forward, and let's let the people decide with the information that they have how to move forward. Because with that energy, and this energy right now, this is how we think we're going to go to Congress and change things, we're only going to be feeding into the climate that's happening right now. I just want to say that. And Congressman Jackson, thank you for your service as well. Just want to say that for the 2nd Congressional as your time as a congressman. Regarding the corporate PACs, absolutely not. In fact, I also want to take it a step further and make sure that I'm leading the charge to ending Citizens United. Because, let's be real, we're moving more and more towards an oligarchy right now. And as somebody whose parents fled an authoritarian government, I'm the son of Haitian immigrants. They fled an authoritarian government where the country was being controlled by a very small percentage of people, and we see where Haiti is today, where now Donald Duck is trying to take the administration, this country, in the same direction. I want to not only not take money from corporate PACs, and I have not, which is why it's been a little bit harder for us in my campaign, But also make sure once I get elected, you get a full commitment from me to fight against Citizens United, to limit the influence of big money in our day-to-day lives and our democracy. Thank you.
The short answer is no. I have not accepted and will not accept any corporate PAC money. When I entered this race, I knew that I wanted to enter this race with a people-powered grassroots campaign. I have been polling second in this race. It is very difficult to run against big money. You can have the biggest heart, the best ideas, but when big money and dark money pours into these races, they have the money to get on TV. They have the money to send mailers every single week. When you have grassroots candidates like myself that have a heart for the people, who want to serve, go to Washington, D.C. to do the right thing, you're outbought, you're outspent, and that's what we need to change. We spent almost 2 hours today talking about the healthcare system and how we're going to eradicate the big ugly bill and how we're going to put people over politics and how we're going to put politics over people. And the bottom line is, when you take that money, you're taking their ideas, you're taking their wants, you're taking their needs. Those are the things that you're taking to Congress. I haven't accepted money because I plan to take the voices that are etched in my soul from the people of the 2nd Congressional District, the stories that I carry with me, the cancer patients that need help and they're on their dying bed and they're being rejected care, the kids that need health care from Lurie's Children's Hospital. Those are the voices, those are the stories that I plan to take with me to Washington, D.C. It is not the voices of the people who can buy this race. From day one, I have said this race is not for sale. But what we need is people to stand with us. We need the people of the 2nd Congressional District to stand with us. And that's how we will outbeat any dollar that is poured into this race. We need to get people to stop looking at the television, stop looking at those ads, but look at the person who has the heart to serve the people. Thank you.
We have 20 minutes left. Can you all pull it together for 20 minutes? Can you all keep it together for 20 minutes? We're only going to take 2 more questions. And these questions did come from the audience. So, what steps would you take to restore mental health clinics that were closed, leaving a void in mental health care in the most underserved neighborhoods?
Well, I'm proud to say that my grandfather was the first Black psychiatrist here in Illinois and graduated from medical school in 1950. So I've been studying, looking at what happens from a psychiatric standpoint and a healthcare standpoint. I worked in mental health in my prior career as well, as far as going from, I've probably been to every hospital in the state of Illinois talking about behavioral health and mental health for decades. And as a Cook County Commissioner, I'm proud to say that we have expanded behavioral health throughout every single clinic in Cook County's health system and throughout the hospital, but that's not enough. We need to put mental health, behavioral health systems in place across our entire country. I was working in the late 1990s when the Tinley Park Mental Health Center closed. That left a real depth of just injustice for what happens for mental health on the south side of Chicago and the south suburbs. I would work to restore mental health and make sure that we are funding it at a national level. I have put legislation forth through NACO, which is National Association of Counties, on a national level so that we have legislation that we are urging Congress to not only fund certain things like behavioral health, but women's health, which all of this goes together. So I will make sure that Congress has the ability to fund our mental health, not only on an institutional level, not just on a hospital level, but we need clinics in our communities to do this work.
Yeah, I mean, look, we had 12 mental health clinics that were closed under former Mayor Ron Emanuel, and I have a deep relationship with people who were doing a lot of the organizing and the fights in Woodlawn to try to prevent that closure. As a state senator, I work with Access Living, a disability rights justice organization, to help try to create a mental health first responder program. We're in the process of implementing that statewide. In the city of Chicago, we were able to, a good friend of mine was able to work work to create the CARES team, which we have to make sure that we create consistent funding, because CARES teams are the ability for mental health first response or mental health response on the moment. So on top of increasing the amount of efforts in terms of mental health first response, we also need to think about how we have to reopen some clinics, while at the same time making it so that people aren't stuck long-term in those spaces, that they're able to go back out, that they have rehabilitative care if they need it, that they have at-home services that they need and funded. So to me, thinking about mental health broadly, it's from the moment of crisis to the moment in which you need to be able to recover, and then the moment you have to go back out into the world of life. I would just say my mom struggled with mental health issues. She basically drank herself to death because of her mental health. She was too ashamed to talk about it. She held it inside. It was very painful. We want people to understand it's okay. You're going through an injury. It's painful. It's tough. But we're here to care for you and give you the support that you need, and to be able to get you out there in the world, and it's going to be okay. We all have your back.
I want to just very briefly address the outlandish statement that Robert Peters made here. I never voted for Trump, but I also did not live my life trying to be a politician my entire life. I said a bunch of stupid stuff on social media. So if you want to get a kick out of the state senator saying silly stuff, just go back on my social media years back like Robert paid thousands of dollars to do. And you'll see some pretty silly stuff. Because I'm like most people, I did not take social media serious. But I'm going to move past that. Here's the truth. I've been in office for my three years, January 11th. 12 hospitals, 12 mental health facilities were closed under my manual. I got right to work. Right now, this year, we're going to open up a new mental health facility as I appropriated millions of dollars to do so with my partner, the Greater Congressional Development Corporation. My brother, my mother's son, suffered from mental health issues, and he nearly killed me as a result of it, stabbed me multiple times. This is deeply personal for me, and I took these actions. Like Ms. Brown said, because I had the heart and the passion for what was happening in our communities. I raised my hand, I grabbed a notepad like Barack Obama, our president, told us to do, and I ran for office, and I earned it. After everybody was against me, I was outspent 30 to 1. I beat the incumbent. I beat the guy who challenged me. I wasn't given a state senate job like Mr. Peters was. We're going to do the same thing here in Congress. We're going to beat the odds, we're going to beat the corporate dollars that Donald's getting from APAC. We're going to beat the name ID that Jesse is relying upon. And we're going to beat the outlandish folks that are running for office that nobody in the district supports them for, like Robert Peters, bringing everybody from the north side to go help them.
Y'all won't make me forget the question. Mental health. Our clinics, yes. The conversation with mental health is also very personal. I have a friend, one of my closest friends, went to college together, and he actually suffered from long COVID. And I don't know how many of you are familiar with that, but long COVID actually deals with your psyche at times, okay? Disassociation. And there's not even enough research right now to back and to understand how to even help treat it. And I can't imagine how many other people right now are having to mask what they're struggling with and still have to go out there and perform. And then with how the political climate is going right now, especially with people at the cusp of losing their jobs, where somebody might snap, and then from there it goes downhill. So the way I actually want to fight to make sure that the mental health clinic, services be provided, is number one, ensuring basic practical appropriations negotiation. Making sure that organizations like Aunt Martha's Community Health Center is well funded. And even if it's not necessarily them being able to secure those funds, just through the usual grant application to HHS, you know, members of Congress, we get to select 11 projects where we get to fund directly, called community project funds. Again, incentivizing different community health center group to apply collectively to ensure that they have a high chance of getting those funds and to be able to service their communities. So I want to take the practical route of making sure that they're applying for those funds through the community funds project to ensure that we're addressing it as a top priority. As a member of Congress, that's how I want to address it. Thank you.
Last question.
So, as a healthcare professional, not only do we need to expand access to mental health services, we also need to expand education and training. So I plan to introduce legislation to not only fund and expand access, but also to build a workforce. We are seeing a huge strain on our healthcare system. And so we need to train more professionals that can tend to patients within our communities. In addition to that, we need to increase and enhance public education so that people know that it is okay to struggle with mental health illnesses. So just to repeat, we need to expand access to mental health care services. We also need to expand education and training for professionals that can give quality care to those patients. And we also need to educate the community and let them know that it's okay and that they have a safe place within their communities to have those struggles. Thank you so much.
Commissioner.
I have struggled with depression my entire life. Most of my life, there was a stigma associated with struggling with depression. But increasingly, the American people are overcoming the idea that people have highs and people have lows. And so yes, I'm committed to mental health funding. I believe that every American deserves the constitutional right to health care of equal high quality. I propose a 4-pillar program, upgrade and let the ACA evolve exactly to where it was intended to evolve to. Address the mental health crisis by expanding Medicare and Medicaid to cover the mental health crisis under the legislation. Hence, expanding access to mental health. And last but not least, and I'll share with you in my closing statement, I do believe that caregiving ought to be advanced to the idea of a civil right. And if I'm elected to Congress in 2027, it is my intention to offer the Civil Rights Act of 2027, the Caregivers Protection Act, for those of us who are responsible for loved ones that the present system doesn't even take into account the changes that we have to go through to provide for people who we care about, that the society no longer cares about, but we have an obligation to make sure that the society right-sizes itself and provides them with the care that they deserve for the lives they've lived for us.
All right, we have come to the final portion, which is the closing remarks. I am going to give everyone 90 seconds, so a minute and a half. But I'm going to let you, Cindy, you're looking at me like, we're going to start with Senator.
Thank you, PNHP, for hosting this. Thank you, everybody, for being out. I'm State Senator Robert Peters. We're technically in the 13th district here. I'm running for Congress because, I was born hard of hearing. I struggled in life. A lot of people are going through pain. And we need someone in Congress who's going to fight with a vision about what this country can and should be. That we can fight to have a universal health care system, that it can be a guarantee. That everybody can have a safe roof over their head. That everyone can retire and have the right to retire with dignity. And we're in a big fight. It is a huge struggle. We are not trying to just defeat Trump, but defeat Trumpism. And so I also have a track record of fighting. I've worked with colleagues on the other side. For example, expanding the raising the age for juvenile incarceration was a bipartisan bill, even though for 10 years it felt impossible. I don't want to ever settle on the idea that something's impossible. They said ending chattel slavery was impossible. Women the right to vote was impossible. Gay marriage was impossible. Until it happened. And so my name is Robert Peters. I'm running for Congress. I'm proudly backed by Bernie Sanders, Tony Preckwinkle, the Congressional Progressive Caucus, NNU, INA, a whole host of labor unions. And my website is www.robertpetersforcongress.com. Please sign up, join us in this fight. We have the ability to really change course in this country. Thank you.
Thank you. Listen, I've been good at one thing my entire life, and that's fighting. And I own that. I got a little round, a little passion here. But Adele, you're a great guy. I've got to know you over these last months. I can assure you that this is not about just trying to punch, but it's also being radically transparent. Yes, I may be a bit audacious. Yes, I'm authentic. And yes, I take action. But let me tell you something. If people in this room want to see Medicare for all actually come to life and be law of the land in this country, then we're going to have to send some people that we haven't sent before. I'm a different type of fighter. I'm going to fight for your families, for our health care, like I'm fighting for my own family. And I can tell you that if we fail in this hour, then everyone in this room, including the Gen Zers, may never see Medicare for all truly in this country. It's going to be more than hearings. It's going to be more than press conferences. It's going to be more than just talking. It's going to be building with people that we may not look like. We may share different regions, so it came up differently. But we're going to have to all come together in this country as one nation over this one pivotal issue, and that's healthcare and life or death of American people. And that's why I fight like I fight. And I'm fighting for us, because I'm one of us. Thank you.
Firstly, thank you again for hosting this. You know, there's a saying that goes that says, nobody cares how much you know until they know how much you care. And I'm running because I care. I care, and I recognize that people are suffering. From day-to-day conversation, whether it's Anthony, that's my target every day, asking for bread, whether it's your next door neighbor that you find out gets laid off and doesn't know how they're going to be able to afford their mortgage, or whether it's people that are losing their mind when they turn on the TV, and some who have the ability to threaten to flee or get ready to move their assets to go overseas, while some of us might have to pick up the tabs. I care. And as the son of Haitian immigrants who left Haiti in the 60s, they left the Duvaliers to come here, looking for the promise of America, and the irony that their sons and their grandkids now have to fight the same fight that they fled. I care that we are at the cusp of losing the republic and everything that we fought for. And I recognize that we are the products of generations of sacrifices, and that we have to step up and be ready to serve. As somebody who's worked for 2 members of Congress for 4 years, and I've been involved politically for 21 years. I'm much older than I look, by the way, in case you wonder. I figured it's time for me to step up and not just complain. And I'm ready to build on some of the things my previous boss, Robin, has done, but also bring some fresh perspective in light of everything that's happening right now. My name is Adele Regis. I'm looking forward to representing you as your next council member if you're willing to give me your vote. Thank you.
I'd like to thank you all for hosting this event to hear our various views on healthcare, which I believe we all align that we want universal healthcare for everyone. That seems like a radical thing, but really what's radical is these healthcare companies that are taking advantage of people in our communities. What's radical is the people that are sick and they don't have access to the healthcare, the quality healthcare that they need. I believe in the first time in our history, we're starting to see a level of uncivility at the top, and it's trickling down to our communities. In order to move forward, we're going to have to build together. No matter who's elected up here on this stage, we have to come together and fight for our communities because the people matter the most. We're seeing that our ancestors, they've had a harvest, and the harvest is dying. We're seeing a level of everything being repealed, from reproductive rights to environmental justices to healthcare. And I'm running because I believe I have the heart, the desire, and the passion to not only fight for my kid, but for every kid in the communities of the 2nd Congressional District. We need a fighter in Washington, D.C. We need someone that's going to go there with fresh, bold, new leadership, and that is independent of someone else sending their voices where we're not thinking about the people of the 2nd Congressional District. I am Yamika Brown. I would love to earn your trust, your vote, and your help to get to Washington, D.C. and on Election Day on March 17th. Let's show them what we can do when we bring people together who care about the communities. And as a reminder, this race is not for sale. Thank you so much.
Healthcare is a top priority in this election. Healthcare is not affordable, and in our district, it is not accessible. We drive north for our healthcare. No one's fighting to get to our healthcare on the south side of Chicago. I have a plan to evolve the ACA. I have a plan to put tens of thousands of people to work in the 2nd Congressional District by bringing the global economy to the district. I respect the positions of all of my opponents, and possibly even a colleague one day in the Congress of the United States. But this district needs access not just to what the government can do for it through bills. We have to be able to attract the global economy to the south side of Chicago and south suburbs. We do need Amazon and Hilton and Fairmont and UPS and Federal Express providing middle-class jobs to take the burden off of homeowners who are choosing between paying their property taxes and whether or not they can meet their premiums. We can do this. Through Governor Edgar, Governor Ryan, Governor Blagojevich, and Governor Quinn, South suburban communities purchased 4,000 acres of land to build one 10,000-foot runway, giving us nonstop access to Paris, to Frankfurt. We can provide jobs on the south side of Chicago on day one, and I'm confident that we can do it with our leadership.
I'm Donna Miller, and as I started when I spoke, I'm a Black woman, I'm a mother, I'm a wife, I'm a professional, and I'm someone who's lived in this district for decades. Family members live in this district, but what I also am is someone who has been fighting for healthcare disparities, for communities of color, for women, and to make sure that we have access all across the board in every community to have the healthcare that we deserve and that we need. Healthcare should not be determined by where we live, and unfortunately, for many of us it is. I've seen this across my whole professional career. I've been on the corporate side, the nonprofit side, the government side, and across the board, what we see consistently is communities of color are disadvantaged. We need to make sure as I go to Congress, I will be making sure that we are uplifting those conversations, making sure we're not only having conversations, we're doing something about it. I have been doing something about these types of issues for healthcare my entire career as a Cook County Commissioner, bringing in money. I know how to go into a budget and find money in the budget where they say there is no money. I know how to look in communities that are struggling and find what they need because I listen to my constituents. And as I listen to constituents right now, what I'm hearing them all say is, we have an affordability problem. We have a healthcare affordability problem. People cannot access healthcare. And I will work for Medicare for all and all of these issues that we've discussed today to make sure that the 2nd Congressional District is on par with every other district in the country for healthcare.
I want to thank everyone for coming out this morning. I want to thank all of our candidates who all came. I don't know how long the candidates will be around to answer questions, but stay for a few minutes, give them a chance to meet them and talk with them. Thank you.